What exactly is an MRI? So unlike X-rays or a CAT scan, an MRI provides a very different type of technology to view soft tissue structures. So instead of looking at the bone for a fracture, we're looking at some of the soft tissue organs or ligaments, tendons, and sometimes things that are behind bone. An X-ray can't go through bone very well. So things like the skull, so we have an entirely encased brain in a dog's skull. If you take an X-ray of this skull, a lot of things are superimposed on top of each other. You can't see what's inside here, the brain. Now, a CT or CAT scan can be used if you're trying to view all the little segments of the bone and evaluate the tooth roots or fractures. Bony changes can still be helpful for a CAT or CT scan, but an MRI is the superior modality to look at the brain as well as examine sometimes the spinal cord. Now, an MRI, as I said, unlike a X-ray or CAT scan, does not use ionizing radiation. Instead, we use a magnetic field and computer-generated radio waves. The magnetic field temporarily realigns water molecules inside the body, and the radio waves cause these atoms to produce faint signals that we're able to use advanced computers to realign and create an image of the brain or whatever we are imaging and evaluating. As a result, we're able to better diagnose why is a patient presenting, for instance, with seizures. It could be something like a blood aneurysm, so a vessel bleed, a blood clot, think about strokes. It could be a tumor, a growth that is a cancerous process. It could be a congenital born with abnormality. All of these things are very hard to diagnose without imaging the brain. And so an MRI is a fantastic way to do this. The downside of MRIs in animals include: one, you cannot ask a dog to stay perfectly still. Most are gonna move. It is a loud machine. It's scary for them to be in a tube. And so animals need to be anesthetized. So they're fully asleep for the procedure and they're being monitored throughout it to make sure that they're not moving and that they're stable. The other downside of an MRI in an animal is cost. If you have pet insurance, then it'll be very similar to an MRI in a human. If you do not have pet insurance, it is a hefty bill. Usually, on average, I believe MRIs are about $3,200, give or take, and that's because it is the same technology used in humans. And if you don't have insurance, you have to cover that bill. It is, of course, a much more involved process in animals than humans because, again, you can't ask them to just lay there. And we're often imaging the things like the brain, the spinal cord, larger areas than just in humans. They may use it to evaluate a ligament injury in one smaller area of the body, so it may not cost as much. But MRIs are an awesome modality to evaluate for, as I said, the brain, different concerns, but also the spinal cord. So if a dog starts having back leg issues and they have spinal pain, one of the most common reasons in animals is intervertebral disc disease. What can happen is the nice jelly donuts that have this outer fibrous ring and inner gelatinous material, those are between each spinal vertebrae in the back. They can rupture open, and that ruptured donut causes compression on the spinal cord. And if you can localize and image the spine and determine where is that spot that's causing compression, then a back surgery can be done to help that dog walk again. It's amazing, remarkable, cool stuff. And so if you are offered an MRI, hopefully that will help you better understand what your pet will be going through, why it's being recommended, and different possibilities of a diagnosis and treatment plan.